Do you have any advice for, especially maybe more junior residents who might feel like they're being left behind because they see their co-residents identifying subspecialties early on, kind of locking into those, and maybe feeling like they are not keeping the same pace as their co-residents?
So I tell them that they're actually, especially at the PGY 1, 2, and early in 3 year, you're actually in the better position. Because number one, you're more open-minded, you're watching. There's a lot of them. It is so funny. I don't know what it is about hand, but a lot of them get to the hand rotation and go, I want to be adult recon, I want to be trauma, I want to be spine. They get on hand, they go, nope, it's hand. I'm like, what happened in there? What did they do to you? We like to pick on hand surgeons, but it's funny how they suddenly pivot and they pop out the other side and they're like, that's what I'm doing. So if you made up your mind too early, you're not going in with that open mind, or you didn't want to hear because I don't want to be a hand surgeon, then you're like, no, that's actually what I should have done. So I think that's an important part. The other part that I iterate over and over to our residents is, although you don't have to be board certified to pre-practice in America, it is really hard to. And if we want to be proud of our residents coming through there, and it's harder to be proud of you if you can't pass part 1. And you can't take part 2 until you pass part 1. And so part 1 is a general exam. And if you're focused on trauma surgery from day 1 of orthopedic surgery, and the sports stuff comes up and you're like, ACL, whatever, what do I care about that for? Then you're missing out on the education that you need, because we are board certified in orthopedic surgery, and we should become competent orthopedic surgeons before we become trauma, hand, foot, and ankle adult recon.
Yeah, absolutely. What would you say, if you had a takeaway, what's one skill that every orthopedic surgery resident really needs, regardless of their subspecialty?
The number one thing graduating residents I hear when they come back and say, I wish I'd spent more time in clinic. I know. But that they say the clinic is where they learned how to indicate people, learned how to nuance those conversations, learned how to do those things. For you and me, clinic ends up being the ER, but we also got to see these folks in clinic afterwards, so that goes there as well. I think the teachable spirit and the art of doing what we do, of knowing what to say when and how to nuance that. And even after you've been doing it for years, you walk out there and go, I did not handle that as well as I could have. Because there is absolutely, as trauma surgeons, I'll use that specifically because that's what you and I do, there is nothing more gratifying than walking into a total mess. And you look at it and you see through the mess, you see the clarity, you see where this is going. The family's shattered, nobody knows what's going on. And you're like, I got this. We got this. This is what we're going to do. It's going to work. Follow me. We got this. Everything's okay. And you watch the whole room settle down and everything. And all of a sudden people are looking at you like, man, I got to deliver this now. But you know you can. And you go back there and you do it and you come out and there's nothing better than you walk out in the waiting room. They're all tense. You're like, remember everything we talked about? Exactly as planned. Nothing surprising. They're doing well. Let me tell you what I did. And you watch the whole thing come down on that. That's what pumps you up and keeps you going day after day doing that. And although that was a very trauma-centric explanation, you could say the same thing in any other specialties, the 9 specialties that we have, shoulder and elbow, foot and ankle, adult recon, spine. It all peds, it all does the same thing.